Hello and welcome. I'm Janae Smith, sonographer at Clarius. We're excited to see everyone here today for our live webinar entitled Ultrasound for Facial Aesthetics, a beginner's guide to scanning like a pro. Today, we're excited to welcome our very own Shelley Gunther, sonographer and clinical marketing manager at Clarius, to share her ultrasound experience and take us back to the basics. So many ultrasound courses and workshops make a lot of assumptions about what those of you new to ultrasound already know. And as Shelley always says, even as a sonographer with many years of experience in the field, she never stops learning. As we know or have been taught, using ultrasound can provide extra information about what's under the skin for a variety of reasons. Whether you're planning treatments, you need to make a diagnosis, Shelley wants you to feel more confident about picking up your ultrasound probe and using it to help you make better decisions in your practices. You're among 4,400 clinicians who've registered for today's popular event. So good morning, good day, or good evening, depending on which part of the world you're joining us from. A housekeeping note, please use the Q&A box at any time during today's webinar, as there will be a live Q&A session following the presentation and live scanning, where Shelley will demonstrate T mode for facial aesthetics. I have the pleasure of hosting today's event, so let's get started. We'll start off with a quick poll to get to know you a little bit better. Do you use ultrasound in your practice today? Do you use it daily, occasionally? Are you just learning today or not at all? I'll give you a few moments to make your selection. So it looks like most of you are just learning today, so you'll get a lot of information out of today's webinar. Without further delay, I'd like to introduce everyone to Shelley Gunther. Shelley has been a sonographer for over 30 years and has worked extensively in general, OB, and cardiac ultrasound. She has also worked in the ultrasound industry in clinical applications as well as ultrasound sales. Shelley joined Clarius late in 2021 as clinical marketing manager and has been instrumental in providing the highest quality educational content for clinicians looking to add wireless ultrasound to their practice, including webinars like today's and Clarius classroom video tutorials. Shelley is passionate about ultrasound and is always happy to spread the word. Shelley, I'll hand the mic over to you.
Thank you, Janae. Wow, 4,400 people. It's amazing. Makes my heart flutter a little bit. This is so exciting. Welcome to the first webinar I'm presenting for Clarius instead of actually hosting. I'm absolutely thrilled to see that so many of you have registered for this webinar. It really says to me that clinicians like yourselves are excited about learning and hungry for more information. I've got a ton of ultrasound experience. It's actually quite a few more than 30 years, so who's counting? But I'm hoping to share some of that knowledge with you to give you the confidence to pick up that ultrasound probe and start making some images. So this is going to be very basic, cover the basic fundamentals. My goal is to leave you wanting more. So let's get started. All right, so a few learning objectives here, and these were kind of outlined in the on the registration page. But we're going to learn a little bit more about what ultrasound actually is and how it works in the body, common applications for ultrasound, which transducer do I use and why, different scanning techniques, and then we'll get into a little bit about image interpretation as well, just to kind of help you get you on your way. All right, so what is ultrasound? Well, what we hear as humans range is frequencies in the region of like 16 to 20,000 hertz. Now, ultrasound waves are typically in the 2 to 20,000 hertz or 20 megahertz range, so much beyond the range of human hearing. Medical ultrasound, also known as sonography, uses sound waves to create pictures inside of the body, and it's wonderful. The beauty is that for the most part, it's non-invasive and non-ionizing, so no radiation. So in the previous slide, we saw sound described in hertz. So there's two terms that really define an ultrasound wave. They are frequency and wavelength. Now, frequency is the number of cycles per second, cycles of the sound wave, and one of those cycles per second equals 1 hertz. Now, wavelength, on the other hand, is the actual length of that wave from one peak to the next. So keep that in mind as we kind of move forward here. So what's important to remember is that frequency and wavelength are inversely related. Why is this important? Well, it has to do with image resolution and the distance that sound can actually travel into the body and then back to the transducer again. So when we image at increased frequencies here, the wavelength is decreased, which means the waves are closer together, which results in better resolution in our images. Now, when we image at a decreased frequency, the waves are farther apart, so the wavelength is longer, which decreases our image resolution, but the sound is able to travel further in the body. And so this little movie is a really good example that explains sound frequency. So if your next door neighbor is listening to really loud music, the bass or the low frequency is often heard through the walls or into your chest. You can't make out a lot of detail, but you do hear or feel the bass. Now, the higher frequency gets absorbed or attenuated by the walls of your house and their house. So the same concept happens inside the body. Now, with ultrasound, there's always trade-offs. Lower frequencies have longer wavelengths, and higher frequencies have shorter wavelengths. So higher frequencies therefore produce higher resolution images, but for shallower structures. So what you want to do is select the transducer with the appropriate frequency that will allow you to image what you want to see well without sacrificing penetration. So like I said, it's always a bit of a trade-off. Now, this is an example of an ultrasound image. So same anatomy imaged at two different frequencies. So I've got this black hole in the middle is my carotid artery. So it's here and it's here. Now, those structures we see well, they don't have a lot of detail in them. But I want you to pay attention to the top of the image, and that's the part that's closer to the transducer, the shallower structure, the more superficial structure. Now, this is a muscle in my neck. We see it, it's dark. I can say with fair amount of confidence that I know that that's a muscle. Same with this probably here, just because I know anatomically that's what that is. But I want you to appreciate on the other image with the 15 megahertz scanner, the detail. We can see nice thin striations throughout the muscle. I can pick up resolve, these two little lymph nodes here, whereas I can kind of see them here, but I'm not getting any definition. I'm also seeing a tiny little blood vessel here, right in this tissue plane that I wasn't able to detect with this one. Now, if we were scanning deeper, I wouldn't be able to pick up things with the 15 megahertz probe, but I would on this one. So, but again, the detail will be lost. So just keep that in mind. It's important for you to know when you're selecting a frequency to scan at or a transducer to purchase. Good. So to summarize, when imaging with ultrasound, there are always trade-offs. To get the best image resolution, you want to scan at higher frequencies, but you have to keep in mind that you won't be able to see deep into the body. Now, if you want to scan abdomens or pregnancies, you'll need a lower frequency transducer. And for facial aesthetics, because we're only looking at about 2 centimeters max into the body, into the face, we can choose a very high frequency probe and benefit from the resolution for imaging tiny little structures right beneath the skin. All right, so with this in mind, let's move into what I call the business end of the ultrasound system. And over the next couple of slides, I really want you to think about which transducer would be best suited for your needs. So you'll hear several terms for ultrasound transducers out in the market and in different sites. Now, it might be called a transducer, it might be called a probe, it might be called a scanner. Different terms, but they all mean the same thing. All right, so the ultrasound transducer is a very complex piece of equipment, but the part that allows it to produce the sound waves or pressure waves are called piezoelectric crystals or elements. Now, electric current is applied to these crystals to excite them, and it causes those crystals to contract and expand, and this creates a pressure wave. Now, these propagate into the body, and then the echoes that are reflected back return to the crystals and then are processed to create an ultrasound image. So that's just kind of the Coles Notes version of how a transducer works. Now, ultrasound probes come in all shapes and sizes, and every manufacturer assigns a name to their transducers, and the names are usually characterized by frequency, and that's usually a number. So like those previous images I showed you was a 3 megahertz transducer and a 15 megahertz transducers. Sometimes they're described in a range of frequencies that they image at. And then the other thing that they are is the array, and that's how the crystals are lined up in the transducer and how they're shaped. So there's a linear, a curved, and a phase. Typically, those are the three. So the linear or linear array transducer is typically a higher frequency, 7 to about 20 megahertz. So it has a shorter wavelength, and as we learned, that's good for superficial imaging like skin, muscle, breast tissue, superficial vascular access, things like that. And the crystals are arranged in a linear pattern. So the resulting image is usually is rectangular. And so this is one example of a linear array. And they can be different sizes as well. So this is our 15 megahertz transducer, and then this is our 20 megahertz transducer. So, very different sizes of the arrays, but yeah, they can vary in size, but they're always straight across. All right, the next one is a curved array. These are typically lower wavelengths, so they're better for deeper structures in the body, things like obstetrics, abdominal. This is a picture of a liver and a kidney here. And this is, I'm sure everybody's familiar with this. This is a fetal profile with a little hand here. So we're able to image deeper in the body. I'll show you an example of the curved array probe here. So it is curved, and the benefit of that is the sound travels out to the sides. And so we get this characteristic sector shape with a curve at the very top of the image. It's nice. The field of view is very wide. So when you're looking at larger structures like kidneys and livers or babies or whatever, you can fit more into your image as you're scanning. All right. And then the final one we'll talk about is a phased array. This is a lower frequency probe as well, usually, and the crystals are arranged in a rectangular pattern. And so this is what that looks like. It's a rectangle. The sound is electronically steered in this one, and it's typically used for cardiac and some deeper abdominal imaging. The small footprint makes it really nice for imaging between the ribs. So for cardiac imaging, it's ideal. It's what most people would choose for cardiac imaging. And if you've got some really big patients where their livers are up under their nipples, you can kind of see the liver in between the ribs. And it also has this characteristic pointy appearance at the top. So that's a really good way to decide which scanner that is as well. All right, so with that in mind, which scanner would you say is best for facial aesthetics? We need high resolution. We probably is probably going to be a linear scanner. So this is going to be our high frequency linear scanner. And then if you're imaging the abdomen, we're going to be choosing a lower frequency curved array transducer. All right, so let's get into techniques for actually performing an ultrasound. Now, attention to things like patient positioning, how to hold your probe, gel, are all things that are going to contribute to your success. So I'll just touch a little bit on this regarding patient positioning. Now, this is going to be different for every ultrasound application and for every person performing the scan. It could vary with your size, the size of your hands, the length of your arms. There's all kinds of variables there. The key is to make yourself comfortable without straining or craning. Ergonomics is very important for ultrasound techs who are performing ultrasounds day in and day out, like on a full-time basis. There's lots of repetitive strain injury that happens with ultrasound techs just because of the repetitive nature. And so they go to great strides to try to improve their ergonomics. So even if you're only doing ultrasound once a day, maintaining proper patient positioning so that you're close to your patient and have a clear view of your imaging screen without having to turn your head and your neck or your body will ensure less fatigue and make scanning more comfortable for longer periods, longer scanning sessions, or even just when you're practicing. All right, so one of the most important things that I find new ultrasound users take for granted is how to hold the scanner when you're doing an ultrasound. Now, there's some finesse involved, and that finesse serves a couple of purposes. It allows you to perform fine motor movements with the probe, and it prevents hand fatigue. So you don't want to have the death grip on your transducer, or you're not going to last very long. Something about applying pressure. Well, when you're using, when you're imaging very superficial structures, you don't want to put a lot of pressure on the scanner because you're going to compress what's right under the skin. But for abdominal imaging, some pressure may be beneficial. You may need to get closer to that organ that you're interested in, or you may need to displace some gas. And sometimes that, for abdominal imaging, that's key. All right, so here's a little video just showing how to hold the scanner. And you want to make sure that you have a good grip with a couple of fingers, and you want the grip to be close to the patient or at the bottom of the probe. And then anchor your hand on your patient so that you can be steady as well as control those fine movements. So what I'm looking at here is I'm trying to get a look at a vessel in the jaw. And this vessel is just a couple of millimeters in size. So any slight movement could result in me slipping off, which is why I'm going to anchor my pinky on my patient. So I just froze the image, and then I rotated the scanner here. And I've got 2 fingers on the probe, and I'm resting my other finger on my model just to stabilize. We're going to do some subtle movements here to try to locate that vessel. And here we're seeing that vessel right in the middle of the screen. And I'm able to maintain that view because I'm nice and steady. Now, if I grab the probe at the top, it's very difficult. So I'm just going to show a different grip here. Very difficult to be steady and to maintain, what I want to see on the screen. So try to get into the habit of holding your scanner at the very bottom and anchoring a finger or your pinky, locating your target, and then just staying put. And that'll really help.
I find too, Shelley, sometimes when you have those very superficial vessels that you're looking to not compress, it helps to have a generous amount of gel on the probe too, so that you can really lighten up that pressure for the really superficial vessels, because those will disappear on you.
Yeah, exactly. Yeah, that extra gel layer just acts as almost like extra tissue between the probe and what you're looking at, right?
Mm-hmm.
Awesome. So while we're talking about gel, one very important key to getting a good ultrasound image, and one of my pet peeves, is when ultrasound users don't use enough of it. It can really have an impact on what you see on the screen. So please don't scrimp. Now, why do we need gel? Well, ultrasound is reflected and shadowed by air due to the mismatch in the speed of sound between air and the tissues or whatever that you're scanning. So using gel ensures that there is good contact between the transducer and the patient. So sound can travel uninterrupted into the body and the tissues and then back again. Now, there's several options available on the market, and they all do the same thing. It's totally a personal preference as to what you decide to use. It could be budget related. I like a thicker gel because it stays put, but some people like something a little runnier so that they can move it around a little bit more. Some people like blue gel so that they can see where it is. Again, it's just a totally personal preference. So you decide. All right, so anatomy of an ultrasound image. Let's get into it here. So the ultrasound image, in order to understand them, you're going to have to teach yourself how to see in a two-dimensional slice. So the ultrasound image is a very thin 1 millimeter slice of anatomy that lies directly beneath that probe. And starting with a pregnancy ultrasound image here, because that's what most people associate ultrasound imaging with. Here you'll notice that this is the uterus here, and this is where our probe is placed. Now, before we even look at the ultrasound image, I want you to think of what you're going to see on the ultrasound image. Now, the probe is over this part of the baby's body, so we're not going to see the top of the head. We're also not going to see the legs unless we move the probe over the head or over the legs. We're also not going to see the arms unless we slide the probe to one side or the other and are right over the arms. So when we look at the ultrasound image, here's what we're seeing. So we're not seeing the top of the baby's head. We're not seeing the legs. We're seeing essentially what's right underneath the probe. And again, just keep in mind that that curved array has a shape like this. So we are seeing a little bit more than what's directly underneath the probe because of that particular array. Now also, we're not seeing the sides of the baby. We're just seeing straight down the midline of the baby. So I'm seeing the jaw bones, the nasal bone, and the frontal bone here, and then the baby's chest. All right, so I hope that's starting to make sense. Here's another example. This is a kidney. So just a little graphic of a kidney. And this is a slice into the kidney. So right in the middle. So here's the vascular structures leaving. Here's the ureter leaving the kidney. Now, the sound is directed by the user, by you. And you point the sound beam directly in the center of that kidney where we see the outer cortex and the contents of the medulla. So here's our ultrasound image. Here's the cortex, which corresponds to this part. And then here's the medulla of the kidney and all of the structures that are in there. So this corresponds nicely with our little animation here. All right, now this is another example. This is a forearm. So this is the slice that we're going to be looking at. So here's our scanner. Here's the skin line. And what we're going to see is what is directly between these two green lines here. So we're going to see some skin. We're going to see some muscle. We might see a nerve, a couple of blood vessels, and then we should see some bone as well. We're not going to see all of the bone, and we're not going to see what's out here as well, because we are only looking at what's directly underneath the scanner, unless we move it from side to side. All right. So here's our ultrasound image. So skin at the top, we've got a nice tissue plane here. Here's the nerve that I'm seeing right here. This darker area is all muscle. Here's a blood vessel. Here's a blood vessel, kind of would represent this one over here. And then here's our bone. It's bright white, and bone always casts a shadow behind it because the sound can't penetrate through the bone. All right, and then here's just an example of probe positioning. So here's me holding the probe over my jawbone. And so what I'm seeing is skin surface here. I'm seeing a tissue plane here. This dark area is muscle just like it looked like on the previous image. And then it's my masseter muscle. And then underneath is my mandible. So it looks bright white and we don't get a lot of detail behind it. So just a reminder, so you're only going to see what's directly beneath the scanner. It's like a flashlight. You only see where you're pointing the sound beam. All right, so let's see what this looks like in real time.
Okay, now that we've talked about holding the scanner and the different scanner movements, let's talk about the ultrasound image itself, and we'll kind of dissect the anatomy of the ultrasound image. Now, I'm going to be imaging my model's thyroid gland, just for reference here. So we're in the thyroid preset. And the first thing I want to talk about is the image from top to bottom. So the top of the image is always the skin of the patient, or the structure that is the absolute closest to the scanner surface. And then what we'll see is markers down the side of the image that indicate the depth into the tissue. So the top of the image is 0 centimeters, and the very bottom of our image is 3.7 centimeters. So keep that in mind when you're trying to establish what you're seeing directly beneath the scanner. Now, the other thing we'll talk about is the orientation of the scanner. Now, every scanner, regardless of manufacturer, is going to have 1 or 2 indicators on one side of the scanner. It'll either be a light, as it is in this case, it may be just a dot, and it may be a tactile nubbin on one side of the scanner that doesn't exist on the other. So when you're imaging in the transverse plane, and I have that indicator to the right of the patient, everything on the ultrasound image that is on the indicator side of the image is to the patient's right. So if I move the scanner, slide it to the right, we're going to see more to the patient's right. And if we slide more to the left, we'll see more to the left, or in this case, more toward the back of her neck. Now, if I rotate the scanner 90 degrees, and now we're looking in long axis on her neck, or a sagittal plane, and I've got her thyroid gland here, the typical transducer orientation is to have the transducer indicator toward the patient's head. Now, if that's the case, everything that is on the indicator side of the image is now toward the head, and everything on the bottom is toward the feet. So if I slide the scanner toward the indicator, we're seeing more toward the head, and if I slide down toward the feet, or the opposite to the indicator, we're seeing more towards our model's feet. So practice those manipulations, keeping those orientation markers on the scanner and on the image in mind, and get used to coordinating which way to move your scanner to get the best image possible.
Great. Okay, so I hope that makes sense to people. It does take a little practice, but you will get used to it. All right, so this next section talks about what makes out the ultrasound image. And now ultrasound is composed of a bunch of shades of gray. And those different shades indicate differences in tissues. And all tissues in the body have a typical appearance on ultrasound that is a result of how strongly they reflect the echo. Now, the shades of gray in ultrasound terms are referred to as echogenicity, which means differences in brightness. So something that's hyperechoic or echogenic, they both mean the same, are going to be brighter tissues. Things such as bone, collagen, PMMA filler is bright. Little calcifications are bright as well. If something is termed hypoechoic, it's an area of less intense echoes, so they're going to be darker. So as we saw the muscle tissue in some of my images before, those would be considered hypoechoic. Anechoic is without echoes, so they're echo-free, they're black. Anything with fluid in it or fluid is going to appear black. So hyaluronic acid, cystic structures, blood vessels, a bladder, urinary bladder. And isoechoic is just kind of the same shade of gray as the surrounding tissues. So let's see what that looks like. So here's an image where this is a parotid gland. So this is the parotid here, and it's kind of gray isoechoic to some of the surrounding tissues. We've got muscle underneath, which is the masseter muscle, which I showed you earlier. So it's hypoechoic, it's muscle. This fatty tissue at the top is echogenic, more echogenic than the surrounding tissues. And then we've got our bright white bone down here, which is hyperechoic. And if I just refer back to my forearm image, so same thing, we've got muscle tissue that is hypoechoic, this nerve that is a little bit more echogenic, and then we've got bone, which is echogenic or hyperechoic. So you'll hear those terms a lot. Just wanted to familiarize with those, familiarize you with them. All right, so now we've placed some gel on our patient, and we've plunked the scanner down, in this case on her neck. How do we optimize our image? The first thing I think I want to tell you about is that many manufacturers do the bulk of the work for you. If you select the right preset or the application before you start scanning, a lot of the optimization is done for you. So that being said, there are exceptions because everybody reacts differently to ultrasound. So gain is one of the most commonly used terms in ultrasound. And generally what it means is that is the brightness of your image, the overall brightness. And when you adjust gain, you're amplifying or decreasing the strength of the sound beam coming back to the ultrasound scanner. So sound interacts differently in different tissues at different levels. So the gain might need to be adjusted depending on the strength of the signal coming back to your scanner. It's like turning up the volume on the stereo. All right, so for example, when I'm looking at this ultrasound image, we're seeing structures that are very dark, that are black, and those are blood vessels, I know that. And we're seeing other structures that are more gray, and we're seeing some darker gray as well. These should all look a certain way, and you'll get used to that. Now, if I turn up my gain to see something a little bit better, what's happening is I'm filling in these areas that I know should be black. So that's almost too much gain. And conversely, if I turn the gain down way too low, I'm losing signal. I'm not seeing what I need to see. So by selecting the correct preset, that will ensure that you get closer to where you want to be with your gain settings. On the Clarius app, there's an auto gain setting that I just turned off there. It's that little orange A. So yeah, so you can turn that off to have more control of the gain if you like. And then what you can do is you can fine tune your gain in the near field, like I'm doing here, or in the far field if I need a little more oomph in the back of my image. So it's make the adjustments as to your liking, but remember that you don't want to lose information on your image. All right, so depth is another very common image optimization. And in this video, I use a linear scanner on the neck again. And you'll notice that my maximum depth, which means the maximum depth that I can scan with my settings the way they are right now, is 3.7 centimeters. So I have my carotid artery here. And if I want to center that artery a little bit better, I'm going to decrease my depth and bring that a little bit more into the center of the screen. All right, so there we go. So no, it's nice and centered here. Now, if my depth
depending on your patient's thickness.
Yeah,
the
exactly.
Neck too, right?
Yeah.
You can fiddle around with it.
Yeah, not everybody's the same. Yeah. Now, if my depth is too deep, now I'm at 7 centimeters. There really isn't any anatomy that I'm interested at 7 centimeters. And so I'm getting a whole lot of nothing down here in this area. So I'm going to just recenter that carotid artery to the optimum area. Great. And now what I'll do next is I'm going to go into the facial aesthetics preset, and I'll look at the chin here, for example. And I'm going to look for the facial artery, which is this little guy right here. So that's a pretty good image. It's fairly centered. I've got the jawbone going across there. I've just optimized it a little bit more. But now watch what happens if I increase my depth too much. All of a sudden, I'm getting this tiny, tiny little vessel up here and a whole bunch of nothing shadowing from the bone here. And so there's no point in scanning at that depth. Optimize it so that what you're interested in is centered on the screen. It's going to make it easier for assessments, for injections, anything along the line. Great. Okay, a couple of scanner movements that you can practice as well. We've got rotation, fanning the scanner, sliding, and rotating. And these are all just image optimization techniques. So in this video, the first one I'll talk about is fanning. And so if I fan the probe, I'm trying to optimize my image. I'm maintaining contact with the skin, but just fanning back and forth until things come clearly into view. So now it's not so clear, this vessel, and now the walls are crystal clear. So I want to find that area And the goal is you want to get the sound beam perpendicular to where you are. So the next motion is called rocking. And that's exactly what I'm doing. I'm either leaning on the top of the probe or I'm leaning on the bottom of it to try to optimize that sound beam interacting with the tissues in the body. So again, I've got the carotid artery here. And if I lean on it to bring it parallel so that the sound beam is interacting with that vessel perpendicularly, I'm going to get the best image. So not so good here. And again, if I just rock the probe a little bit, sometimes it's called heel toeing the probe, then look at how much clearer. There, I've gone the other way here. And look at how much crisper those vessel walls can be. So that's called rocking the scanner. So now we're going to slide the transducer. And so I'm keeping on the carotid artery here. Sorry, this is rotation. So I'm going from long axis in the carotid, and then I'm going to rotate the scanner 90 degrees to see it in short axis. So when you're practicing this, try not to look at the scanner in your hand. Keep your eye on the screen. Keep this centered while you're practicing your movements, and you'll just have continuity. You won't lose sight of the vessel or the structure that you're looking at, and you're trying to get that orthogonal plane. All right, and then the last thing we'll talk about is sliding. So I'm centering the carotid again, and I want to see it higher up. I'm just sliding the probe, maintaining that same angle, but just sliding up and down. And that just gives you a more thorough look at that vessel in its entirety in cross section. Okay, we're going to move on to ultrasound artifacts now. Shadowing, it's produced when the sound beam encounters sound absorbing material. So we talked about that with bone. Artifacts can be really helpful, and they can also be troublesome. So as you'll notice, we can't see through the shadow, but it does help us to identify something that is very solid. And in this case, it's a gallstone within the gallbladder. So anytime we see a shadow, it's indicative. It helps us to diagnose calcifications, bone. If I see a little bright echo within a kidney and there's a shadow behind it, I can pretty much be guaranteed that it's a kidney stone. This is PMMA filler. So it's bright in the front here, but look at the shadow behind it. And that's just because of the way that the sound is absorbed from all the little microspheres that is in that filler. There's also an artifact called posterior acoustic enhancement. And it happens when the speed of sound increases through the fluid, and it causes this brightness behind the structure that has fluid in it. It's always seen deep to cysts in the bladder, other fluid-filled structures. And again, it can help us with diagnosing or determining what we're looking at. If we just see something dark and we're not sure, if we see that posterior acoustic enhancement behind there, then we know that there's fluid there. This is another quick example here. This is a testicular ultrasound, and there's a large cyst at the top of the testicle. So brightness behind that, there isn't any behind here. All right, so up to now, we've discussed the most important and most common imaging mode, which is B mode or brightness mode. It's also referred to as 2D or grayscale imaging. There are several other ultrasound modes, and today we don't have time to dive into the details, but I wanted to at least familiarize you with them, because you will hear about them or you may see them on your ultrasound systems. The one I do want to touch on is color Doppler, and it's a very useful tool to identify blood flow blood flow with ultrasound. Now, on a very basic level, turning on the color Doppler or power Doppler tells the ultrasound system to assign a color to things that move, specifically blood cells. So a blood vessel, because it's fluid filled, will appear black. So here's our little blood vessel right here, or cystic on the B mode image. But how do we confirm that the structure we're looking at is indeed a blood vessel and not a cystic or a fluid filled mass? So this is an image of a chin again, and I see that tiny little black structure, and I turn on the color Doppler and I have my answer right away. So this is filled in with color, and now the answer becomes clear. Another example would be if I'm looking at a gallbladder, it's cystic. If I turn the color Doppler on and I don't see any flow, then we know that it's not a blood vessel. This is just one more quick example here. This is a pocket of hyaluronic acid, and this is a blood vessel over here. So clearly there's no blood flow in this. So we can say, yes, this isn't a jumbo blood vessel in the face. We know that this is a pocket of filler. All right, so we've covered a lot in this introduction, and I'm going to leave you with these practice tips. And trust me, like anything, you won't get better unless you practice. The good news is that it's ultrasound. It's fun. You can practice on your family and friends. You can practice on a piece of tofu, a pork chop. Try different things. Try different movements. Try to keep your movements small and slow to start with. And once you get the hang of it, start enrolling in more courses that will teach you more about ultrasound that is specific to your specialty. So I really hope this helped make a little more sense of ultrasound. Most of all, I hope that anyone intimidated by ultrasound will pick up their transducer and start using it. There's a lot of smart people out there who are willing to help and answer your questions and mentor you. So ask for help. And remember that no one's an expert straight out of the gate. So take your time, be patient with yourself, and learn to love this amazing technology as much as I do. Now, for all you facial aesthetics learners out there, we will be hosting Dr. Stephen Weiner for a webinar in March. So you'll be able to see him demonstrate scanning procedures and detailed anatomy in the face. So you'll be able to apply what you've learned today to actually getting to know more about facial ultrasound anatomy. So with that, I'm going to make my way over to give you a quick demo here.
Perfect. All right, thanks, Shelley. That was a lot of useful information. As we promised earlier, we will be doing the draw for Dr. Weiner's new book, Atlas of Ultrasound and Anatomy. And we have quite a few people listed here. We'll just do a quick random draw. And it looks like the winner is Mohammed Khalife. Congratulations. We'll be sending out that book to you.
He has an L20 scanner, and he uses it for scanning TMJ and all kinds of things like that. Awesome. So that's fantastic.
That's great. He'll find this book very useful.
All right, good. Here we go. I'm going to just start scanning her face. But the first thing I'm going to do is select the appropriate preset like we talked about before. And to do that, we have a new feature called the aesthetics protocol. So I would go in here and select the aesthetics protocol. And from here, I can select the part of the anatomy that I want to look at just on the fly. I can quickly jump from place to place. So if you're doing vascular mapping or anything like that, you can jump right in and be where you want to be quicker. All right, so now I'm on her jaw here. And so what we're seeing is the jawbone, the mandible, so hyperechoic or echogenic. This is the masseter muscle here. So hypoechoic, I'll just bring the gain up a little bit more. I'm also going to turn on my voice controls so that I can operate my scanner hands free. So increase depth. Great. Okay, and then what we'll do is we will just look for that little vessel, which I see right in the middle of my screen. So I'm going to decrease my depth because I want to center that. So decrease depth, center guide. So now my vessel is right in the middle. And if I want to confirm that that's a vessel and not a cystic structure or a little pocket of filler, I'm going to say power mode. And that brings up the power Doppler. I'm just going to move that box a little bit. That vessel is coming across the mandible here. So we're getting really nice filling in that vessel. So no doubt about it that that's a blood vessel. Great. Power mode turns it off. And now what I'm going to do is I'm going to head up to the temple. So I'm going to pick the forehead temple preset. This gives me a little bit more depth, and then I will just place the scanner on her temple. So this is really nice. We're seeing nice frontalis muscle here. We're seeing some tissue planes, and I'm also seeing bone underneath, so the temporal bone. Now, again, if I wanted to decrease gain, I can just tell the system to do that. And now the other thing for all of you learners out there, we have something called T mode. I'm going to go into the modes menu here and select T mode. This is a fantastic educational tool. So it's defining the tissue layers for you and assigning different graphical overlays to them. And the nice thing is that when you say freeze, it's actually going to label those for you. So I can cine back. This is all done in real time. And so for learners, it's fabulous.
Yeah, you can really see the borders between that deep fat muscle or the deep fat and the muscle. On the B mode image, it doesn't look so obvious.
Yeah,
and
exactly.
When you see it on the T mode, it really brings out the differences.
Yeah. And if you're
great for
questioning,
learners.
if you're questioning yourself, you can just pop that on and go, yeah, okay, that's what I thought. That's definitely what I'm seeing, right? Yeah, it's pretty cool.
Very cool.
We also have T mode for the lips. You okay with me scanning your lip here? Okay. And I'm just going to go to the lip preset here. And we'll just put the scanner down here now. We know that we're seeing a nice muscle here, which is the orbicularis oris muscle. But if I want to just make sure that's what I'm seeing, I can turn on my T mode. This just acknowledges that this is an educational tool. And there's my anatomy right there. So we're getting some superficial fat. And then this is the muscle layer underneath. And again, we can get the labels there.
Awesome. Yeah, the borders are really brought up.
Yeah. It just kind of helps you learn, and then just kind of confirms what you're looking at as well. So yeah, really nice addition to the educational portfolio there.
Yeah.
Excellent. Good.
Awesome.
Thanks,
Thank you, Shelley. We're so excited about the new T mode. This is certainly game changing, and I'm looking forward to hearing about how this makes ultrasound less intimidating for ultrasound users. Just before we open the floor to questions with our guest speaker, here's a quick poll question for you. We'd love to help everyone continue their journey in bringing ultrasound to their aesthetic practice. So please do complete this poll if you'd like any additional information. You can click on as many options as apply. Please go ahead and select as many options as you wish. While you complete this poll, I'd like to take a minute to tell you a little bit more about the Clarius L20 HD3 scanner, the world's only ultra-high frequency ultrasound in a 20 megahertz wireless scanner. You no longer have to purchase a bulky, expensive ultrasound system that's complex to learn if and when you're ready to add ultrasound to your practice. Miniaturization and innovation mean high definition imaging is now easy and affordable with image quality that rivals traditional systems at a fraction of the cost. With high definition imaging of the skin, muscles, vessels, fascial layers, you'll gain confidence with your needle placement and easily characterize and evaluate fillers and more accurately treat complications. This improves patient safety with consistent treatment outcomes. Clarius is also wireless, freeing up space with zero footprint. It's fully immersible and so much faster to clean and disinfect as well. Only Clarius delivers scanners with an ecosystem that includes a free app with your iOS or Android devices with free updates. And included with your membership and one-time license are AI-powered features to automate workflows, like the vessel depth AI and the new T mode AI, which Shelley demonstrated for you today, as well as voice controls. Membership also includes aesthetics presets for the lip, temple, forehead, piriform, cheek, and chin to automatically optimize imaging. It will now take 3 seconds to close our poll in 3, 2, 1. So thank you for participating. We'll get back to you in the coming week. So let's get to your questions. We have quite a few here. I want to let you know that a recording of today's session, as well as a PDF copy of the presentation, will be emailed to you in the coming days. Please use the questions icon in the menu bar to ask your questions. And please do complete our closing survey to provide your feedback so that we can bring you more educational webinars like today's. So we have a few minutes here, but we have quite a few questions. So I'll just choose a couple that might have come up a few times. Okay, there was one here that somebody asked where they can purchase the gel that you like. Do you have any ideas? Amazon?
I purchased mine on Amazon. Yeah. It's
there's lots of different options on
just
Amazon.
called Wavelength CL, but yeah, there's all kinds of different kinds. And if you're working in a hospital, sometimes the hospital will actually have a supplier that they use. So you could try that as well.
Yeah, right. There's another good one here. How high is high enough for facial aesthetics? 10 megahertz, 15 megahertz, or 20 megahertz for the linear array?
Well, the higher the better. Again, like I always like to pick the highest frequency that is available to me, that I can still see what I need to see. So, I mean, the 20 megahertz is optimal. The other thing you have to think of with a little bit lower frequency probes is the size of the footprint. And because you need to be getting into little nooks and crannies and up here, and do you want to be fighting with a larger scanner as well? So they're all things to consider. I think what you need to establish is how well do you see the anatomy that you need to see. But yeah, like I said, higher is always better if you can maintain scanning at the depths that you need to see. So if you only need to see about 2 centimeters deep, maybe 3, I would go with a 20, hands down, if I had the choice.
Yeah, I agree. Okay, we've got one more here. What do nerves look like on the ultrasound? That was asked a couple of times.
Oh, okay. Yeah. So nerves are typically oval in cross section, and then linear in long axis. But in cross section, they're quite distinct in that they're bright, but they have these dark little fascicles throughout them. I don't know. We always used to say find the ovary because they look like an ovary with follicles on it. But yeah, it is quite distinct. It's different from a tendon. So if you look at the wrist, for example, you'll see lots of kind of oval structures. Some of them are tendons and some of them are nerves, but the nerves will have a distinct little dark fascicles within them. They're once you see them, you can't unsee them.
Yes, I agree.
Yeah.
There was one question about how we can get started in purchasing an ultrasound probe from Clarius.
Yeah, you could just visit our website, just clarius.com, and there's lots of different options there if you wanted a virtual demo, or if you just wanted to go and purchase, or if you want to see one at a workshop. We have a list of workshops of where we're going to be in the next little bit, workshops and conferences. So if you wanted to see it for yourself, you could do that. So a few different options there.
Okay. Another one here, if color mode is not available, is it possible to determine a vessel with a pulse?
If it's a really tiny vessel, sometimes it's really hard to determine a pulse. And if anybody has any peripheral vascular disease, that stiffens that vessel wall. And so the pulse is even harder to pick up. So yeah, like if you're looking at something big, a big artery in the arm or the aorta or something like that, the carotid artery, then absolutely you can see a pulse. But the color just confirms it for you, especially with those tiny little vessels.
Yes, I agree with that as well. There's a question here. Somebody is asking, how long would it take to get comfortable using ultrasound for aesthetics with no prior ultrasound experience?
It's a tough one. It's such an individual thing. Like I know when I started doing ultrasound, and one of the first areas I trained in was obstetrical ultrasounds, and I thought, about 2 or 3 months into it, I thought I was losing my mind because I just thought I was never going to get it. But then all of a
Yeah.
sudden one day, the
It
light
just
came
clicks, right?
on and
Yeah.
it started to make sense.
Yeah.
So you just have to use it. Like, it's not going to come to you from a textbook.
Yeah.
You have to get your hands on it and get comfortable with what you're seeing and what you're not seeing, and those transducer movements, and just figuring out what things look like. There's a ton of YouTube videos out there. We have lots of classroom videos on our website that are free, lots of different webinars. So I think if you can kind of get the basics down and get familiar with what you're supposed to see, then it's just a matter of doing it and practicing. And the more you practice, the better you'll get. I know, like Janae said at the beginning, I've been doing this for years and years and years. And until I joined Clarius, I never knew facial aesthetics. So I'm still learning. I know how to scan, but I don't know
Yeah.
the anatomy, like some of the plastic surgeons, or like what you people do. You know your anatomy. So just think of that anatomy when you put that probe down and what you think you're going to see, and then just start putting the pieces together.
It's like learning a new language. The more
It
that you
is.
practice it, the better you get at it. Yeah.
Yeah, absolutely.
I agree.
Yeah.
There was a question here. Does the scanner pick up needle tips as well?
Mm-hmm. Yeah, ultrasound is it's all about how that sound beam interacts with what is underneath it. So if you've got your needle at an angle that's, that the sound is going to reflect off of and bounce back to the scanner, yes, you're going to see it. It's going to be easy to see it. And I find with facial aesthetics, usually the angle that the needle is going into is, I don't know if you guys could see this, but it is more like this. And so the sound beam is going in and reflecting right away back to the scanner, and you're going to see that needle. It's going to be bright. The more like this you can get that needle, the better you're going to see it. The more the angle starts to drop off and you start doing deeper injections, then it gets a little bit tricky. But then guess what? You toggle your probe, so now you lean on one side so that now your sound is going to reflect off of that needle a little bit better. And that's the finesse side of it. Those are the things that you learn just with a little bit of practice. And yeah, like I said, I every once in a while I'll get a cheap pork tenderloin that's on sale, and it's a nice big chunk of muscle. And just imaging that and getting a needle from work and just playing around with that and seeing what that looks like, that's really helpful.
Yeah, I agree. The more you practice, the better you get.
Totally. Yeah.
How common is it right now for aesthetic physicians to use ultrasound in their practice?
I don't, I'm not going to say that everybody uses it, because I know that that's not the case, but I think more and more people are using it, and customers are asking for it. They want you to be safer. They want to know that you're not going to hit a blood vessel. They want to have their hyaluronic acid filler dissolved. So how are you going to do that if you can't see it? You can see it with ultrasound, and you can guide your needle directly to it. So, what I've heard in the field is that customers are starting to get to be a little bit more demanding and saying, look, are you using ultrasound? Because if you're not, I don't think that you're safe enough. So it's increasing. And again, I think the more people use it and the better they get at it. And Dr. Weiner will have some comments about that in his webinar as well.
An extra tool. That's always
Yeah,
good.
exactly. Yeah. Yeah. If you can see under the skin, why wouldn't you? If you can see where you're going, why wouldn't you? Ultrasound is just this amazing non-ionizing tool that we can use to look at anything pretty much. So why not?
I agree. All right, we've reached the top of the hour. So to conclude, I'd like to thank Shelley for her enthusiastic insights, and a very big thank you to all of you for joining us. Have a wonderful day, and remember, practice makes perfect. Thank you.
Thanks, everyone. Thanks, Janae.
Thank you.